Okay, guys. Today what I'm going to go over is DVT and how it leads to pulmonary embolus. So a couple of things you got to know. And again, knowing this makes it pretty simple to understand. Number one, there's no pressure in the systemic veins, right? So that's why you got to put a tourniquet on somebody's arm to draw blood, so it'll build up pressure and the vein pops out. The other thing is that the largest veins of your body are deep inside muscle, specifically your leg muscles. So when you move, you get up and walk around, the muscle will squish the veins and it will force open those one-way valves. And it is that series of contraction and relaxation of skeletal muscles that allows that venous blood to get back to your heart. The other thing is that you probably ask, well, gee whiz, you're not always getting up and walking around. True, right? So breathing, it's called the thoracic pump. The actual act of breathing will actually work like a suction device to suck that blood up into the right side of the heart. So remember, because there's no pressure in the veins, when you take a breath in, the pressure in the thoracic cavity decreases, and your heart's in the thoracic cavity. And when you breathe, you contract your diaphragm, so that puts pressure of your guts. It will compress that abdominal vena cava. So the abdominal vena cava is under high pressure, and the heart's under low pressure, and things always move from high to low. So that's how venous blood gets back to your heart with breathing. And remember that all the venous blood gets dumped into the right side of the heart. And the right ventricle then sends that oxygenated blood to the lungs. The important thing to remember is that in the pulmonary vessels, as they get deeper and deeper into the lungs, they get smaller, right? That's very important. So let's look at this. First of all, if you think about it for a minute, who's at risk for DVT? Right? Number one is people who are immobile. Right? So if they're not moving around, no pressure in the venous system, and blood that doesn't move, especially venous blood that doesn't move, because arterial blood's always moving. Venous blood that doesn't move has a greater tendency to clot. And because there's no pressure in the veins, that makes it even more likely. Right? So if you're immobile, say for example you're a quadriplegic, these people are at risk for DVT because they're unable to move. Now, post-surgical patients, right? These people, especially abdominal surgery really, really painful. So people don't want to get up and move around. That's why when they come out of surgery, they got those sequential decompression devices on, the little like big boots that inflate and deflate, and that mimics you walking, and that will compress the veins and get that venous blood back to your heart. So when Nurse Ratched is trying to get you up and walking around, she's not doing it to be mean, she's doing it to save your life. The quicker you get up and are mobile, the less likely that venous blood will clot and form a pulmonary embolus. Now, the other thing is that post-surgical, they're given anticoagulants. They're given drugs like Lovenox. And the reason they're given that is because doctors and nurses know that patients who don't move have a greater risk of developing a deep vein thrombosis. So those are the people that you have to watch out for. The other thing is that we also just learned, or you probably already knew it, that breathing does that. That's why if you have abdominal surgery, in order to breathe, you got to contract your diaphragm and squish your guts, right? So that's going to kind of balloon out your belly when you do that. Well, if you've got a big cut down the middle of your belly, the last thing you want to be doing is taking big, deep breaths. That's why you give them some morphine, and then you have them do that incentive spirometry. Again, breathing will prevent the little alveoli from collapsing, developing atelectasis. But the other thing that breathing does, it promotes venous return. All right. So this is how it works. And remember, a deep vein thrombosis causes a pulmonary embolus. It does not cause a stroke. A deep vein thrombosis causes a pulmonary embolus, not a stroke. So here we go. Dude, he's just, maybe sitting there. He ain't doing too much. Maybe doing a little breathing, not reading the textbook. Anyways, what will start happening is platelets start sticking together, and then red blood cells start sticking together. And again, venous blood that's not moving has a greater tendency to clot. So in this video, it appears to be a marshmallow treat with certs in it. The certs with red. Remember that? Anyways, so watch. Now you got this. What? Hang on here. My epic pen ain't epic. So what's happening is, due to that venous stasis, right? Venous blood not moving, you're going to form that clot. Now this is the important piece too. Veins get bigger as they move closer to the heart. So when that DVT dislodges, it's not going to block any of the veins on the way back to the right side of the heart. So that is free to travel back to the right side of the heart. And when it travels to the right side of the heart, in the lungs, the pulmonary vessels get smaller. So when that right ventricle contracts and sends the blood to the lungs, the little pulmonary vessels will block that off. So pulmonary circulation is going to get blocked off. So the first symptom of a pulmonary embolus is severe shortness of breath. They will get chest pain, and they will become severely short of breath. And they will also have this impending feeling of impending doom. And if the pulmonary embolus is big enough, then they can end up dying. So as a nurse, what you want to do is remember that, and you want to get this person breathing right away, and you want to get them moving right away. So again, a DVT will not cause a stroke. It will cause a pulmonary embolus, blocking the pulmonary circulation. So that you're not sending enough blood to the lungs to get oxygenated, and the brain's going to interpret that as hypoxia, and it's going to stimulate breathing and the sympathetic nervous system. So they'll be anxious, sweaty, tachycardic, all those things that go along with it. So this is just a real quick discussion on pulmonary embolus and the importance of monitoring patients for pulmonary embolism, especially post-surgical, or people who are immobile. Now, people who have a genetic predisposition, who have some abnormal clotting going on in their blood, if it's severe enough where they're forming blood clots in the veins routinely, what they will do, that's a bad color, is they will place an umbrella, kind of like a little strainer, in the inferior vena cava. Now, why in the inferior vena cava? Watch. We're not always moving our legs. Mostly we're moving our arms a lot, right? But we're not always moving our legs. So a venous blood clot is more likely to start in your legs. So if you have a clot that forms in the legs, when it dislodges, again, the veins get bigger as they get closer to the heart. So what will happen is this clot that's forming, it's going to go through the inferior vena cava, and then it's going to get caught by that little umbrella. And these umbrellas are coated with an anticoagulant that can break down that clot. So they're placed in the inferior vena cava because that's the most common place to develop DVT. All right. Just real quick too. Again, and here's one of my famous drawings. So I don't know how much value it's going to be, but here we go. Watch. What does a DVT look like? Okay. Okay, that's a foot. That's the best I got. And remember, you have arteries that take blood down to the cells of the body, and they're under pressure. And because arteries are deep inside the body, they're warmer blood, and because they have a lot of oxygen, right? It's redder, if that's a word. Now, the oxygen goes into the cells, right? So you got cells down here. Oxygen is going to go in, and then CO2 from the cell is going to go out. So arterial blood now becomes venous blood. So if you have a clot in a vein, a DVT, then what's that foot going to look like? Well, that arterial blood is still going to be able to go there. And arterial blood is red and warm, and it's under pressure, right? So because it's red and warm and under pressure, and the venous blood can't get back to the heart, what's going to happen is fluid, plasma from the blood, is going to start getting squished into the interstitial spaces of those cells. So it will be swollen. So these are the hallmarks of a venous clot. Why? Because arterial blood is still able to get down there, but the venous blood's not going to be able to return. So the pressure in the capillary is going to increase and force some of that fluid out. Now, let's look at an arterial clot for a minute and what that would look like. If you have an arterial clot, then no warm red blood is going to be able to get down there. So if no blood is coming down there and no oxygen is coming down there, then there's no venous blood to bring back. So in an arterial clot, the below the side of the clot, that leg or foot is going to be cold, pale. And remember, it's the arterial system that produces pulse, the pulses, right? Because there's pressure in it. So no pulse. And they will complain of pain initially. And then as the tissue begins to die and the nerves begin to die, they're going to complain of numbness and tingling. And if this clot isn't removed and circulation, arterial circulation isn't reestablished, then this person will end up losing that limb. So what's really important is for you to understand the difference between an arterial clot and a venous clot. And understand that because there's no pressure in the veins, venous clots are much more likely to occur. All right, so I hope that helped. Hello?